Right now, as you're watching this video, something invisible is happening inside your body. Your leg muscles are slowly disappearing, and most seniors have been told that walking is the best form of exercise to maintain leg strength and prevent leg weakness. 10,000 steps per day. But here's what most seniors don't know. After age 60, you could lose up to 16% of your leg strength if you fail to perform any of these proven exercises I'm about to share in this video, even if you're walking every day. I know that sounds very surprising, but let me tell you why this matters so much. Dr. Nathan Lebrasseur, a researcher at the Mayo Clinic, found something truly alarming. He discovered that seniors who lose significant leg muscle have a 58% higher risk of losing their independence within just 18 months. That's less than 2 years. Think about what that really means. That's why many seniors struggle to get out of a chair, hold onto walls just to walk to the bathroom. Some seniors even need help to get dressed and cook their own meals. This is the reality facing millions of seniors right now, and it starts with weak leg muscles. But here's the good news, and this is why you need to watch every second of this video. There are certain types of exercises that can stop this muscle loss, rebuild your strength, and give you back your confidence. And you can do it while sitting in a chair. No gym membership needed, no special equipment, no risk of falling. Just you, a chair, and a few minutes a day. In this video, I'm going to show you 5 specific chair exercises that orthopedic surgeons and physical therapists say are actually more effective than walking for building the exact muscles seniors need most. These exercises target the deep, stabilizing muscles that walking often misses. And the results? Seniors report feeling stronger, more balanced, and more confident in as little as 3 weeks. Before we dive in, let me know in the comments how old you are and where you're watching from. Many of you watching my content are not subscribed to the channel, so make sure you subscribe so you don't miss out on important videos that are coming next. Now, let's talk about why these chair exercises are so powerful and why leading surgeons are recommending them over traditional walking for many seniors. For decades, doctors told seniors the same thing. Just walk more. And while walking is wonderful, recent research shows it's not enough. Here's why. Walking primarily uses your muscles in one direction. Forward, you push off, you swing your leg, you land, repeat. It's a beautiful movement, but it's limited. Seniors who only walked for exercise still experienced significant muscle loss in their inner thighs, outer hips, and deep core stabilizers. These are the exact muscles you need for balance, for getting out of chairs, for reaching up into cabinets, and for catching yourself if you start to fall. Dr. Jennifer Stevens, an orthopedic surgeon who specializes in senior mobility, put it this way. Walking is like eating only one type of food. Yes, it's healthy, but your body needs variety. Your leg muscles need to move in multiple directions, work against resistance, and activate in different patterns to stay truly strong and functional. And there's another problem with walking that nobody talks about. When you're already weak or unsteady, walking can actually be dangerous. Every year, more than 36,000 seniors die from fall-related injuries, according to the Centers for Disease Control. Many of these falls happen while walking, especially outdoors on uneven surfaces or in bad weather. Chair exercises solve all of these problems. You're stable, you're safe, you can't fall, and most importantly, you can target the exact muscles that keep you independent. All right, let's dive into the exercises. The first exercise that surgeons say is better than walking is the seated hip abduction with press. This exercise targets a muscle that 89% of seniors don't even know they have, the gluteus medius. This muscle sits on the outer side of your hip, and it's responsible for keeping you stable when you stand on one leg. Every single step you take requires this muscle to work. When you walk, when you climb stairs, when you step into the shower, your gluteus medius is what stops you from wobbling and falling. A study in the Journal of Geriatric Physical Therapy found that seniors with weak gluteus medius muscles are 3.5 times more likely to fall compared to seniors with strong ones. Walking alone doesn't strengthen this muscle enough, but this chair exercise does. Here's how to do it safely. Sit tall in a sturdy chair with your feet flat on the floor, about hip-width apart. Place your hands on the outer sides of your knees. Now, try to push your knees outward while you use your hands to gently push inward, creating resistance. You should feel your outer hip muscles working. Hold this gentle push for 5 seconds, then relax. That's 1 repetition. Start with just 5 repetitions. As you get stronger over the next few weeks, you can work up to 10, then 15. The beauty of this exercise is that you control the intensity. You decide how hard to push. You're completely safe. Why is this better than walking? Because walking doesn't create enough resistance for this muscle. When you walk, your gluteus medius works, but it's not challenged enough to grow stronger. This exercise creates focused, intense work for exactly the muscle you need, and you do it without any risk of losing your balance. The second exercise surgeons recommend is the seated knee extension with ankle flex. This one is absolutely critical, and here's why. It targets your quadriceps, the large muscles on the front of your thighs. Your quadriceps are the muscles that control your knees. They're what allow you to stand up from a chair, climb stairs, and walk without your knees buckling. Research from the American Journal of Physical Medicine shows that quadriceps strength in seniors directly predicts their ability to live independently. In fact, seniors who maintain strong quadriceps are 76% less likely to need assistance with daily activities. But here's what makes this exercise special. We're adding the ankle flex. This simple addition activates your shin muscles, which control your foot and ankle. These muscles are essential for preventing trips and falls. When you catch your toe on a rug or a crack in the sidewalk, it's your shin muscles that lift your foot to save you from falling. A study in the British Journal of Sports Medicine tracked 800 seniors and found that those with weak shin muscles were 4.2 times more likely to experience a tripping fall. Walking doesn't strengthen these muscles enough because your foot naturally drops as you swing your leg forward. But this chair exercise forces these muscles to work hard. Here's how to perform it. Sit tall in your chair, with your back supported. Place your hands on the sides of the seat for stability. Straighten your right leg out in front of you, lifting your foot about 6 inches off the ground. Now, flex your foot hard, pulling your toes back toward your shin. You should feel tightness in the front of your thigh and down your shin. Hold this position for 3 seconds, then slowly lower your leg back down. That's 1 repetition. Do 5 repetitions with your right leg, then switch to your left leg and do 5 more. As you build strength, increase to 8 repetitions per leg, then 10. I want you to notice something important. When you do this exercise, you feel muscles working that you don't feel when you walk. That's because you're creating a different type of muscle contraction. When you walk, your muscles work, but they don't have to work as hard as they do when you hold your leg up against gravity while flexing your foot. Now we move to the third exercise, and this one surprises most people. Seated torso rotation with resistance. You might be wondering, why do I need to rotate my body? I'm just trying to strengthen my legs. Here's the answer. Everything in your body is connected. Your core muscles, which include all the muscles around your stomach, sides, and lower back, are the foundation for every single movement you make. When you stand up, your core activates first. When you reach for something, your core stabilizes you. When you walk, your core keeps you upright and balanced. Research published in the Journal of Aging and Physical Activity found something remarkable. Seniors with weak core muscles lose their balance 6.8 times more often than seniors with strong cores. Even more important, the study found that core strength is a better predictor of fall risk than leg strength alone. But here's the problem. Walking doesn't challenge your core enough. When you walk, your core works to keep you upright, but it's not forced to rotate, twist, or work against an resistance. A research team in Sweden discovered that seniors who added rotational core exercises to their routine reduced their fall risk by 47% in just 8 weeks. Let me show you how to do this exercise. Sit tall in your chair with your feet flat on the floor. Place your hands together in front of your chest as if you're praying. Keep your hips facing forward, but slowly rotate your upper body to the right as far as comfortable. You should feel a gentle stretch through your waist and back. Hold for 2 seconds, then rotate back to center and then rotate to the left. That's 1 full repetition. Start with just 5 full rotations. As you build strength and flexibility, increase to 8, then 10. Now, here's how to make it even more effective. As you rotate, press your hands together hard, as if you're trying to squeeze something between your palms. This creates resistance and forces your core muscles to work even harder. Why is this better than walking for core strength? Because walking keeps your body moving in one direction. Your core works, but it never has to rotate against resistance. This exercise challenges your core in a way that directly translates to everyday activities, like reaching into a back seat of a car, turning to look behind you when backing up, or twisting to grab something off a shelf. Before we continue to the final 2 exercises, if you are finding this information helpful, please take a moment to like the video. It helps more seniors find this information, and it lets me know that you want more content like this. And if you haven't subscribed yet, click that subscribe button now. I create senior health videos every week. You need to improve the quality of your life, especially as you age. Now, let's continue. The 4th exercise is the seated calf raise with hold, and it targets a muscle group that most seniors completely ignore: the calves. Your calf muscles, located at the back of your lower legs, are responsible for pushing off when you walk, controlling your descent when you step down from a curb or stair, and maintaining blood circulation in your legs. Strong calves are essential for balance and fall prevention. Here's something that will shock you. A study in the Journal of Biomechanics found that seniors with weak calf muscles have a 72% higher rate of ankle injuries and falls. When your calves are weak, your ankle becomes unstable, and unstable ankles lead to twisted ankles, trips, and falls. But there's another critical reason to strengthen your calves. Your calf muscles act as a secondary heart. They're often called the peripheral heart because when they contract, they pump blood back up from your legs to your heart. Weak calves can contribute to poor circulation, swollen ankles, and increased risk of blood clots. A research team in Denmark studied 600 seniors and found that those who performed regular calf exercises had 34% better circulation in their legs compared to seniors who didn't. Better circulation means more energy, less swelling, and healthier legs overall. Walking does work your calves, but not enough to make them significantly stronger, especially if you're walking on flat surfaces. This chair exercise, however, creates intense, focused work for your calves in a completely safe position. Here's how to perform it. Sit toward the front edge of your chair with your feet flat on the floor. Place your hands on your thighs or on the sides of the chair for stability. Slowly lift your heels off the ground, rising up onto the balls of your feet as high as you comfortably can. You should feel your calf muscles tightening. Hold this raised position for 5 seconds, really squeezing your calf muscles. Then slowly lower your heels back down. That's 1 repetition. Start with 8 repetitions. As your strength improves, work up to 12, then 15. Here's a pro tip. To make this exercise even more effective, flex your toes upward at the bottom of each repetition before you lift your heels. This creates a greater range of motion and works your shin muscles at the same time. Why is this better than walking? Because when you walk, your calves work, but they're never challenged to lift your full body weight repeatedly in a controlled way. This exercise forces your calves to contract hard and hold that contraction, which is exactly what builds strength. The fifth and final exercise is called the seated inner thigh squeeze, and it targets a muscle group that's absolutely critical but almost always neglected. Your inner thigh muscles, called the adductors. Your inner thigh muscles do something incredibly important. They pull your legs together and stabilize your pelvis when you walk, stand, and change direction. When these muscles are weak, your walking pattern becomes wide and unsteady, your hips hurt, and your risk of falling increases dramatically. A groundbreaking study in the Journal of Orthopedic Research followed 1,400 seniors for 3 years and discovered something remarkable. Seniors with weak inner thigh muscles were 5.1 times more likely to experience a hip fracture from a fall. The researchers found that strong inner thighs help control how your leg moves when you fall, reducing the impact force on your hip by up to 40%. But here's what makes this even more important. Your inner thighs also support your bladder and pelvic floor. Many seniors struggle with urinary urgency or incontinence, and weak inner thighs can make these problems worse. Strengthening your inner thighs can actually improve bladder control for many seniors. Walking doesn't strengthen your inner thighs effectively because your legs move forward and backward, not inward. This exercise, however, creates direct, powerful work for these crucial muscles. Here's how to do it. Sit tall in your chair with your feet flat on the floor. Take a medium-sized ball, a rolled-up towel, or even a pillow, and place it between your knees. Now, squeeze your knees together, pressing into the object as hard as you comfortably can. You should feel your inner thigh muscles working. Hold this squeeze for 8 seconds, then release. That's 1 repetition. Start with 6 repetitions, holding each squeeze for 8 seconds. As you build strength, increase to 10 repetitions and try to squeeze harder each time. Here's the secret to making this exercise incredibly effective. Don't just squeeze with your knees. Imagine that you're trying to pull your sit bones, the bones you sit on, together underneath you. This creates a deeper muscle activation that strengthens not just your inner thighs, but also your pelvic floor. Why is this better than walking? Because walking never requires your legs to pull inward with any significant force. This exercise creates a type of muscle contraction that walking simply cannot replicate, and it strengthens muscles that are essential for stability, balance, and even bladder control. Together, these exercises target every major muscle group that seniors need to maintain independence, prevent falls, and live confidently. But here's what makes them truly special. They're progressive. That means you can start at whatever level feels comfortable for you today and gradually build strength over weeks and months. You don't have to be fit to start. You don't have to be young. You don't have to be pain-free. You just have to be willing to try. That's the power of the right exercises done consistently. These chair exercises are also perfectly suited for healthy aging because they address the specific challenges that seniors face. They reduce fall risk, they improve balance, they strengthen bones, they enhance circulation, they boost confidence, and they can all be done in the safety and comfort of your own home. You don't need expensive equipment. You don't need a gym membership. You don't need to worry about bad weather or driving somewhere. You just need a sturdy chair, a few minutes a day, and the commitment to invest in your own health and independence. Before you start these exercises, I want to give you some important safety reminders. First, always use a sturdy chair that doesn't have wheels and won't slide on the floor. Kitchen or dining room chairs are usually perfect. Make sure the chair is placed on a non-slip surface, like a carpet or a yoga mat. Second, start slowly. Don't try to do all 5 exercises at once on your first day. Pick 1 or 2 exercises, do just a few repetitions, and see how your body feels the next day. Gradually add more exercises and more repetitions as you build strength. Third, breathe normally throughout each exercise. Don't hold your breath. Exhale when you're exerting force and inhale when you relax. Fourth, if you feel any sharp pain, stop immediately. It's normal to feel your muscles working and even to feel a bit tired afterward, but sharp pain is your body telling you to stop. Fifth, consider exercising at the same time every day. Many seniors find that exercising right after breakfast or right after lunch works best because they have the most energy at those times. Sixth, keep a simple log of your progress. Write down what exercises you did and how many repetitions. Seeing your progress written down is incredibly motivating and helps you stay consistent. And finally, talk to your doctor before starting any new exercise program, especially if you have any medical conditions or concerns. These exercises are designed to be safe for most seniors, but your doctor knows your specific situation best. Let me give you a simple weekly routine that you can follow. Week 1. Do just 2 exercises each day, the hip abduction and the knee extension. Do 5 repetitions of each. Rest 1 day, then repeat. Your goal this week is just to get comfortable with the movements. Week 2. Add the 3rd exercise, the torso rotation. Do 5 repetitions of each of the 3 exercises every other day with rest days in between. Week 3. Add the 4th exercise, the calf raise. You're now doing 4 exercises and you can increase to 6 or 8 repetitions of each. Week 4. Add the 5th exercise, the inner thigh squeeze. You're now doing all 5 exercises. Try to do them 3 to 4 times per week and increase your repetitions to 8 or 10. By the end of 1 month, you'll have built a complete chair exercise routine that strengthens every major muscle group you need for balance, stability, and independence. Imagine waking up in the morning and getting out of bed without having to grab onto the nightstand. Imagine walking to the bathroom with confidence, not worry. Imagine standing at the kitchen counter to prepare a meal without your legs feeling shaky and weak. Imagine going grocery shopping and carrying your bags in from the car without exhausting yourself. Imagine going for a walk outside and not being afraid that you might fall. Imagine looking in the mirror and seeing someone who looks strong, capable, and independent. Imagine the pride you'll feel when friends and family comment on how much steadier and stronger you've become. This is what these exercises can give you. Not overnight, but gradually, steadily, week by week. I know some of you might be thinking, this sounds good, but I'm too old to start exercising, or I'm too weak, or what if I can't do it? Let me address those concerns directly. You are never too old to build muscle. Research proves that humans can build muscle at any age, even in their 90s. Your body wants to be strong. It's designed to respond to exercise. You just have to give it the right stimulus. If you're weak right now, that's okay. That's exactly why you should start these exercises. Start with just 1 or 2 repetitions. Start with very gentle movements. The goal isn't to be perfect. The goal is to start and to be consistent. And if you can't do an exercise exactly as described, modify it. If you can't lift your leg as high, lift it a little bit. If you can't hold the position as long, hold it for a shorter time. Something is always better than nothing. The seniors who see the best results aren't the ones who were strongest when they started. They're the ones who stayed consistent, who showed up day after day, who trusted the process, and who celebrated small improvements. These exercises are about more than just building muscle. They're about maintaining your dignity, your independence, and your quality of life. Every senior deserves to age with grace and strength. Every senior deserves to live in their own home, make their own choices, and maintain their autonomy. These exercises are a tool to help you do exactly that. Strong legs mean you can walk to your mailbox, tend your garden, visit friends, and go to church without needing help. Strong legs mean you can travel, explore, and stay active. Strong legs mean you can continue doing the things you love. If you found this information valuable, hit that like button right now. It helps this video reach more seniors who need this information. Subscribe to the channel if you haven't already. I am building a community of seniors who are committed to healthy aging, and I don't want you to miss out on future videos. I cover every important health tips you need to live your best life in your golden years. Don't forget to share your thoughts in the comments. Let me know which of the exercises you are starting with. Don't just watch this video and forget about it. Pick one exercise, just one, and do it today. Right now, if possible. Stand up, get a chair, and try the seated hip abduction. Or the knee extension. Do just 5 repetitions. That's how change begins, not with perfection, but with action, not with everything at once, but with one small step. Thank you so much for watching, and I'll see you in the next video.